us to the last award for the day, the evening, the afternoon. It's a very heartwarming bio. If you haven't already read it, and I would encourage you to read so in the book, I'd please call upon Michael Harpin, the Executive Director, Industry Relations of HPI, to present to Melodie Hicks, the Coordinator of the Malawi Nursing Exchange, Vanier College.
Thank you. We'll make it short and sweet and make the deadline. Thanks to the support of many of the companies that are present in this room today, my organization, HPIC, has been working at increasing or improving access to medicine in the developing world over the last 25 years. And we do that with a number of collaborators or partners, as we call them. And today I'm here to honor a very special partner of ours, Melodie Hicks. A nursing professor at Vanier College, Melodie has been traveling to Malawi since 2008. She initiated and led the Vanier Malawi Nursing Exchange program since 2011. You've heard us this morning talk about that. The goal is to teach nursing students about healthcare in the broader world, but also to not take for granted the medications and the tools that are so readily available here in Canada. So each year, Melodie travels to Malawi with her nursing students, providing much needed care, both in the central hospital, but also in rural villages. Not only do they bring their skills and passion, but also the tools and medicines that are simply not available. Since 2011, as she mentioned this morning, over $100,000 worth of medicine and well over 10,000 treatments were provided. Not satisfied with that, Melodie's organized the shipment of containers of equipment and supplies, as well as hundreds of textbooks to the Kamuzu College Library. She's also involved in the establishment of many projects in rural Malawi. One of these, the Chizomo Health Organization, delivers primary care to a population of 20,000. Oh, and I don't know if I mentioned it, she's also involved in building a hospital. Thanks to Melodie, the people of Malawi get better care, and we, right here at home, will benefit from nurses who have been inspired by her tremendous passion for helping others. So it's my honor to introduce the 2014 recipient of the Phil Diamond Award for Community Service, Melodie Hicks.
Thank you. You've already been so patient with me today. And I just want to say that this has been an incredible day. I didn't know what to expect, but I really do feel like this was just such a privilege to be here with all of you. What an incredible group of people. So I want to thank all of you for making this such a special day. I also want to thank all those who made this day possible, because you've got some incredible venue going on here, and I feel like as a nurse, I've been not privileged to all the wonderful things that are going on in your industry, and I liked bridging that gap today. It was great. I'm not going to tell you anything more about Malawi. You've seen some photos, and I think you understand what I'm trying to do. I think really, you know, as most people have said, you don't do or undertake projects like this without support. And I certainly do have the support of a wonderful husband and children who are not here today. But I am lucky to have a colleague of mine that we were in university together, and she has been there every step of the way. She's traveled to Malawi with me. She's kind of my silent partner. She doesn't like the attention, but she has been the wind beneath my wings for many years now, and that's my colleague here, Michelina Catalazzi. Yeah. I mentioned earlier that I have learned an awful lot through this process, and one of the things that I've learned is, remember I mentioned about being a bit persistent. Perseverance. And so I'm going to leave you with just a little story, because for me, I think it was a bit of a turning point in what I was trying to do when a particular situation arose. I returned to Malawi in 2011 to find that a good friend of mine had suffered cerebral tuberculosis and was unable to walk. Father of 6, a police officer, very respected in the community, was confined to his home. And that just just wasn't right. And so I promised I would send a walker, a wheelchair, whatever I could, back for him as soon as I could. And I returned back to the college and found out that another group was leaving and going to Malawi in about 3 months' time. And so I approached the leader of that trip and I said, you know, could you guys carry this walker, as it turned out to be, to this friend of mine? And they said, sure, no problem. But as it got closer to the date of departure, the leader of the trip approached me and said, you know, Air Canada, I shouldn't be saying that, but it was Air Canada, will not allow any extra baggage. And so I'm sorry, we're not going to be able to take your walker. I was absolutely devastated. I'd made this promise to this friend of mine, and I don't know, I became, like I said, that dog with the bone. I wouldn't take no for an answer. I went home and I dismantled the walker and I put it into 10 little packages, and I figured, who is going to refuse to carry a little package? Because it was aluminum, it was pretty light, it would fit in that carry-on luggage. So I returned back to the college the next day with my 10 neatly tied up packages to give to each of the participants of the next trip. And my colleague wasn't impressed. She really felt that she'd made it clear that she was out, and actually accused me of trying to save Africa. And I think it was that moment that I went, whoa. If I'd ever given anyone the illusion that I was trying to save Africa, or that I didn't understand the scope of this, like the scale that I was having an impact on, I am, not disillusioned. I'm certainly well aware that the impact that I'm making in sub-Saharan Africa is a drop in the bucket. With 16 million people, as I mentioned earlier, in Malawi alone, what I'm doing could be considered pretty insignificant. However, for that mother with HIV who didn't die of pneumonia, or that child that was convulsing from malaria who survived to see their second birthday, or that man writhing in pain from neuropathy who's been crawling around on his hands and knees, I don't think they would see my efforts as being insignificant. And so I tell my students that pangono pangono, which in Chichewa means little by little, to not become overwhelmed by the need, because you will do nothing, you'll become paralyzed. What we need to do in partnership, which I've heard over and over here today, which is really exciting, if we work together, we can affect change, both here at home and throughout the world. So I'd like to thank you for recognizing my, some would think, insignificant efforts. They seem pale in comparison to some of the things some of you have accomplished. But I really do appreciate that you recognize that every effort is worthwhile. So, zikomo kwambiri, thank you very much.